Okay, everyone. Today is Thursday, July 21st. This one's gonna be quick. It's not gonna be that long. I'm gonna get straight to the point and get started. Okay, so what we're looking at is Department of Health and Human Service Centers for Medicare and Medicaid Services. This is Long Beach Memorial Medical Center. Okay, there's the address. It's on Atlantic Avenue. It's not far from my home. The date of the survey was on April 20th of 2022, so it was this year. So we'll get started. Let me see where can we get started at? Okay, so we'll get started right here on number 4 at the bottom. Matter of fact, we'll go up a little bit up behind one paragraph ahead of that. And so it says a review of the facility's policy and procedure titled Hemodialysis Patient Care Coordination dated 11/2021 indicated. Now look, pay attention to the dates. All of this stuff is really like recent, and there's a reason why, and you'll see why. You guys will see right now. So, dated 11/2021, November 2021, indicated that the primary registered nurse was responsible in obtaining and documenting the patient's weight before hemodialysis. Number 4, based on an interview and record review, the facility failed to ensure all licensed nurses adhered to the policies and procedures of the hospital when registered nurse number 1 failed to implement the high-risk fall interventions action to prevent the patient from falling. One of 30 sample patients, patient 1. This deficient practice resulted in patient 1 falling and sustaining an acute complete fracture. Bone breaks completely of the left femoral neck hip bone fracture. This deficient practice also had the potential for serious injury or death for all patients classified as high risk falls. Okay. So basically, right there's what happened. So what they're talking about right there is something I install. I've installed these in a lot of Kaiser hospitals when I was with IBEW. They do a lot of this for the hospitals. And as a VDV, fire life safety tech, doing sound communications, sound communications journeyman, our job is to install these nurse calls and sensors. So one of the ways this works is there's the band that the hospital patients now carries. There's a chip on that. That chip, okay, that chip is censored. Okay, it's able to be sensed by the on the outside of the hallways and inside the rooms. There's little sensors. Some of them are like on the electrical outlet sometimes, and they look like little antennas. I don't know if you guys have ever walked into a hospital and seen these little devices. They look like little antennas throughout the hallways and stuff. So these what those are to triangulate your movement about in the hospital, so they could tell if you're moving around in the hospital or not. They're supposed to turn these sensors on. The nurse call itself, there's one on next to the bed which senses pressure. So when someone moves from one place to another and tries to move off the bed, the alarm goes off. Okay, there's a sensor on the bed that lets everyone know that there's someone's trying to move off the bed. All right. So what happened here is the nurse failed to initiate this device. As a result, this is really crazy. This is only going to get worse, guys. Okay. So on April 12, 2022 at 4:22 p.m., an immediate jeopardy, a situation with facility not compliance with one or more requirements of participation has caused or is likely to cause serious injury, harm, impairment, or death. Situation was identified due to the facility's failure to ensure all licensed nurses adhere to the PP when RN1 failed to implement the high-risk interventions for patient 1 as indicated. Okay, the IG situation was called in the presence of the Chief Executive Officer, the CEO, Chief Medical Officer, the CMO, Chief Nursing Officer, the CNO, Manager of Quality and Patient Safety, Quality Manager number 1, and Vice President of Ancillary and Support. So this was really big, as you guys can see. All the CEOs had to get involved. On 4/14/2022 at 2:06 p.m., the IJ situation was removed in the presence of the CEO, COO, CNO, CMO, VPAS, MQPS, and corporate VIP of the Quality and Risk. After the team validated the hospital's directive action plan through observation, interviews, and record reviews. Now listen to what they said right there. All right, guys, pay attention to right there. After the team validated the hospital's directive action plan through observations, interviews, and record reviews. So because they talk to everyone and they see something, so they have a directive action plan the hospitals are now carrying out. All right. So here are the findings. Okay, a review of patient 1's history and physical dated 3/10/10/20 indicated the facility admitted patient 1 on 3/10 for a fall on assisted living facility on the same day, and had dementia condition that affects brain function, including remembering things and reasoning. A review of patient 1's fall risk assessment tool dated 3/10 indicated patient 1's fall risk score was 20 on admission. The tool also indicated that a score of 11 or greater classifies patient as a high fall risk. They knew this person was going to get up and walk off and try to get off the bed. It's on his records. It's right there. It's on his records. Okay? They knew that the patient was high fall risk. So they should have had that fall sensor activated. All right. Now moving forward, a review of patient 1's progress notes dated 3/12/22 indicated that patient 1 fell while attempting to walk without assistance, and that patient 1 tripped on SCD, sequential compression device, a machine used to help prevent blood clots, while admitted to the hospital. A review of patient 1's physical therapy evaluation dated 3/14 indicated that the patient 1 complained of new onset pain in the left thigh and groin. A review of patient 1's X-ray report dated 3/14/22 indicated that patient 1 sustained an acute complete fracture of the left femoral neck with displacement. The bone snaps into 2 or more parts and moves so that the ends are not lined up straight. Okay. A review of patient 1's orthopedic surgery consultation progress notes dated 3/15, only one day, indicated that patient 1 fell at home prior to admission and sustained a head injury and then had a fall while in the hospital. The progress notes further indicated clearly the pelvis was intact at the time of admission and the fracture must have happened in the interim. I recommended bipolar arthroplasty, a surgery to repair the hip bone and restore the hip function once the patient is optimized. I explained, blah, 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 that the patient is a high surgical risk for a number of complications, including death, can potentially take place. However, doing nothing is not necessarily a better option. All right. So as we can see, one of the surgeons was in favor of trying to fix the hip and trying to do something, because doing nothing is not cool, right? Pay attention, guys. Pay attention. Okay. Continue from page 15. A review of patient 1's orthopedic surgery consultation progress notes dated 3/19 at 10:27 indicated recent developments noted the patient on comfort care, end of life care, will cancel the surgery and sign off the case. Did you guys hear that shit? All right. A review of patient 1's discharge summary dated 3/24 at 5:02 indicated despite the best efforts of medical teams, patient 1 was getting worse instead of better, and that we felt continuing aggressive intervention was not going to provide a significant benefit to his quality of life or provide a meaningful recovery. Patient's DPOA, or durable power of attorney, durable power of attorney, a person who has legal authority to make medical decisions for you when you are unable to do so, change the code status to DNR, do not resuscitate, and patient was placed on comfort care. Patient passed away 319 at 5:12 p.m. Did you guys fucking understand what just happened? During an interview on 3/25/2022 at 9:24 a.m., RN1 stated that she was the primary nurse assigned to patient 1 on 3/12. RN1 stated that she did not turn the bed alarm on and she did not know why she did not turn it on. During an interview on 4/12 at 12:03 p.m., RN2 stated patient 1 had an unwitnessed fall on 3/12. RN2 found patient 1 in his room on the floor. RN2 stated the bed alarm was not alarming when he found patient number 1. And you guys are like, so this is like basically the Long Beach Memorial was being surveyed and they were failing. They were showing how they failed, and this was one of the cases where someone actually like died as a result of this. Not only did they die, it was like it was almost like it was their fault. You know, like it was their fault.
Hey,
Yeah.
you got like 5 minutes?
All right, I'll be over there. Okay, so moving a little bit fast because I'm also it's my grandson's birthday party. So impact of surgical intensivist on clinical outcomes of patients admitted to a surgical intensive care unit. An intensivist is a key factor in the mortality of patients admitted to the intensive care unit, the ICU. The aim of this study was to evaluate the effect of the intensivist on clinical outcomes of patients admitted to the surgical ICU. Okay? During the study period, the surgical ICU was converted from an open ICU to an intensivist-directed ICU managed by an intensivist who was board certified in both general surgery and critical care medicine. When compared consecutive presence admitted to the surgical ICU before and after implementing the intensivist directed care, the primary outcome of the ICU mortality and secondary outcomes were hospital mortality, 90-day mortality, length of hospital stay, ICU free days, ventilator free days, and ICU readmission rate. So basically what they're saying is this: the surgeon doesn't call the shots anymore. Even if the surgeon wants to resuscitate and try and save you, it's up to an intensivist to decide whether you get to live or not. And if they feel that you shouldn't live, you die. Straight up. Okay? That's what we just read right now. There's more examples of these, which I'll start posting so you guys could see. This is not a joke, everyone. This is really happening. Okay? They are depopulating us. There's no fucking way around it. Okay? I have friends that have been killed off like this already. Okay? This is real, guys. Do you guys even science, bro?